My name is Papiya Mukherjee. I am from London, UK. I'm a single mother, so my life was very busy with my 3 children and very normal. And all of a sudden, in 2019, I had problem swallowing food, any type of food, whether it is solid or semi-liquid. And initially, I was not having any idea that why I'm having this problem. And it started affecting my work life, my normal life. So I went to my GP and they suggested me to go for camera test. But due to COVID, I was not getting any appointment with a specialist or for any kind of test or anything. And it started affecting my life badly, my work life and everything. So then after some time, somehow I got appointment for a barium swallow test, which confirmed that my condition is called achalasia, where I have problem with swallowing food. But again, I was waiting to have appointment with a specialist or for endoscopy, but I was not getting any appointment for that, and I waited for almost more than a year for the appointment, and I started losing weight. I lost almost 13 kgs of weight, and the condition was getting really worse, and I was not having a normal life after that. And then because I had a long wait time in UK, I went to my son in Australia, and then somehow he managed to get an appointment for endoscopy, and the endoscopy again confirmed that it is achalasia and I have to go for a manometry test and POEM procedure. But they said that POEM procedure, you need to have a very expert hand because it is a very rare kind of a disease. So we were very concerned about that, finding a specialist for that and expert hand. And manometry, again the wait time was 4 months and surgery was, I don't know how long it was. And the doctor said that you have to go for the procedure as early as possible because I was having lots of deficiencies because I lost weight. I was anemic and I was not able to eat anything properly, and continuously, rapidly I was losing weight. That's when one of my friend introduced me to Mr. Bali in Narayana. And after discussing with Mr. Bali referred me to Dr. Sukrit in Narayana. And we were still a bit concerned because we were both coming from outside the country, so how to manage, we didn't know anything about this place.
So Papiya had come to me from Australia with the complaints of dysphagia, and she had initially consulted me from abroad on phone, and I had told her how the procedure will be done and how we usually require 2 to 3 days stay, and how it is a relatively easy procedure to do, and it can be done with minimal tests done before. So she had come here. We quickly did the manometry and then some pre-operative evaluations, and then we admitted her on the day of the surgery. The surgery lasted for about an hour or so, and the patient was then shifted to her room.
My mother, when she was visiting me in Australia, I've always heard from her how her condition is impacting her. But when I saw her in person, it dawned on me the toll it has taken on her health. She lost a lot of weight between the times when I saw her before and when I saw her this time. And that scared me, genuinely scared me. And because this is such a rare disease, we were both struggling to find a way to treat this or to find the next step forwards. I can't tell you how many achalasia groups she had joined just to find the answer for what needs to be done next. We reached out to general physicians, we tried to get appointments for manometry, for endoscopy, but due to COVID and due to a shortage in appointments, we had to wait a long time until through her contacts she got a chance to speak with Mr. Bali, and after that he told us that we can reach out and talk to Dr. Sukrit Sethi. He's a gastroenterologist and he was the most kindest person. He guided us, he told us exactly what's required for us to move to the next step forwards, and it put my mind at ease. I felt confident that I could now help her. We had a path forward, so I was able to then put together my financial planning to fly out to India to come and book an appointment here and talk to him face to face. And he must be one of the busiest person, but he did not ever make us feel like that. He always gave us the time. He sat with us. He took the time to explain what this condition is, how it can be treated, why we are doing certain tests. And when you are trying to help a family member, this kind of information is invaluable.
Before surgery, my condition was very bad. I think my son will be able to tell you. He saw me in that condition. I was not able to eat anything. I always used to carry a big bottle of water with me wherever I went because I was losing my confidence. I was not able to go anywhere, eat anything without water, and I lost all my confidence and everything. I was not able to do any normal work, anything, and I was on sick leave for so long. But now after surgery, I'm feeling so good that I'm again able to eat any type of food, solid or liquid. I just can't believe it that my life has again become so normal.
My first experience of visiting Narayana Superspeciality Hospital was something that I can only describe as an amazement. So I came here. I have received treatment in India before through other hospitals, but there's something very different about this place. As you enter, everything is very well organized. Everyone, you can see for yourself that there's a lot of emphasis on cleanliness. You can see that there are clearly marked signs and indications of where each of the different departments are. There is a designated waiting area, so there are lots of seats where you can sit down, and even with the admission process of admitting a patient to the hospital, it's all very clear and straightforward. The staff are very well dressed, they are very helpful and easy to approach.
I recommend Achalasia cardia patients, if you have been dealing with these symptoms, to come and get evaluated by your gastroenterologist with a manometry, a barium swallow, an endoscopy, and then go ahead and get this procedure done, because it is very successful and patients have no post-operative complications virtually, and patients may be discharged as early as the following day.
So I don't have words to express my feeling and my gratitude to Dr. Sukrit, Mr. Bali and the entire hospital staff, because everybody was so good and so supportive. So I don't have words to share my feelings, and thanks to everyone.